Thank you. Good afternoon. I'm Councillor Graham Bridgman. I'm Deputy Leader of Council. I'm Portfolio Holder for Health and Wellbeing, and I am Chairman of this board. I'm supported this evening by Councillor Joe Stewart, Vice Chairman of the board, and other members of the committee in attendance, Councillors Lynn Doherty, Councillor Dominic Bowick, Steve Masters, and looking round the room, that appears to be that for members. We also have Matt Pearce, Service Director for Communities and Wellbeing, Joe Reeves from the CCG, Meredith Peachy, Director of Public Health for Berkshire West. And have I missed anyone? I don't think so. And then we have officers supporting us, Martin Dunscombe and Sean Murphy, and Jack Karimi is our clerk and Zoom host. So we're being live streamed on YouTube, and let's start on the agenda. Members and others, are there any apologies for absent Jack?
I was aware of it. I'm trying to find the email. We have apologies from Andy Sharp.
Thank you. Anyone else want to raise a hand? No, I see nothing. Okay, so the first substantive item, the minutes of the meeting that was held on the 16th of August. Does anyone have any amendments they need to propose? I'm happy to propose those from the chair. They have a second, Councillor Doherty. Thank you. All those in favour, stick a hand up. Thank you very much indeed. Right. Declarations of interest. Does anyone have any specific declarations to make? No, fine. So we get on to the meat of the meeting, and the first item on the agenda is a situation report on COVID. Over to Matt.
Jack, can you just give me permission to share my screen, please?
You are now co-host.
Thank you. So evening, everyone. I'm just going to take you through the latest data. The first slide that you'll be familiar with is the summary across Berkshire. I've highlighted West Berkshire as always, just with the blue line. And interestingly, West Berkshire is actually showing quite a significant rise in rates above both the national and regional average, which is one of the first times in the pandemic. But I'll talk you through that and try and explain why that might be the case. So in terms of the individuals tested per 100,000, a number of the local authorities have seen some slight reductions in those. The positivity rate, again, is higher than what it has been. So it's 9.7 in West Berkshire, which again is higher than the regional and national average, and highest across all of Berkshire as well. As I just alluded to, the cases per 100,000 are also highest across Berkshire and higher than the regional and national average, so at 354, which is a slight increase. And then in cases per 100,000, 60 plus, again, we're seeing an increase in West Berkshire, highest across all 6 local authorities, higher than the regional average, but just slightly lower than the national average. And in terms of the number of cases we're seeing, it's around 562 per week. So we're still seeing quite significant community transmission across the district. So in total, there's been 11,000 confirmed cases of COVID to date. And as I mentioned, there's been 562 over the last week. So again, this epigraph just shows you what I just described. The blue line does show in West Berkshire. So again, you can just see it's higher than the grey bar, which represents England, and the amber bar, which represents the southeast. So obviously, we're trying to unpick what might be the contributing factors behind the rise in rates, and it is tricky. Obviously, data is coming through all the time. Certainly what we can see from this graph, which is the heat map you'll be familiar with in terms of age ranges on the left hand side and dates on the bottom, the black representing quite a significant number of cases per 100,000, and so we're seeing a lot within the 19 to 24 age group, 17 to 18, and 11 to 16. In particular, our 15-16-year-olds, we've seen 143% increase decrease, and it's now 1,771 per 100,000, and equally in 1718, whilst there's been a slight decrease, we're still seeing just shy of 1,500 per 100,000. Obviously, what that doesn't tell us is why our rates are higher than the regional and national average. That's certainly something we're looking at. We're already making some understanding of the data and potential links to Reading Festival. That could be a contributing factor amongst a whole of other reasons. Obviously, we're trying to look at common exposure reports to understand where people have reported that they may have been prior to, or to understand where they may have become infected. Did you want me to take a question now, Chair, or should I continue to the end? I just noticed Councillor Masters' hands gone.
Yeah, I mean, I was going to ask, it's one of those questions as to whether we butt in on your slides or wait to the end. If Councillor Masters, if you bear with me, I'll just ask my question and I'll come to you in a moment. Obviously, one almost didn't quite assume, but certainly thought, Reading Festival, here we go. But that doesn't answer the question as to why West Berkshire has been affected. I wouldn't say been affected by Reading, because that's an assumption, but has that increase in rates, which seems to, we seem to have shot up in comparison. I know other areas have also gone up, but we seem to have shot up in comparison. So I just wonder whether you have any thoughts of that, and then I'll come to Councillor Masters.
Yeah, I mean, we can't definitively say what we want to happen is a big headline to say, Reading Festival is a cause of that. That's certainly not what I'm saying. I think it could be a contributing factor, and obviously testing goes back to the residents and where they reside, not where they actually go. So it could be that a number of our residents, higher proportion of our residents have been to West Berkshire. But as I said, yeah, it could be a number of factors, and that's something we're trying to unpick. But it's really hard to understand exactly why West Berkshire is rising quicker. It could be that when the hypothesis that we've always had incredibly low rates, so there's less immunity within our local population. But again, it's really hard to substantiate that claim at this moment. Councillor Masters, happy to take your question.
Yeah, thank you. Through the chair, it was about the the historic low rates, below the national and regional averages, and then suddenly we've gone up. And I did wonder whether there was any analysis on whether or not there was less immunity, and clearly it's the younger age group that's shot up almost exponentially. I think certainly by an incredibly high percentage. I was going to ask about. My hand was going up mainly because I wanted to just be in the queue for questions. So it was pertinent to probably something, more data that you're going to have regarding hospitalizations and stuff like that. So I can hold fire on that if that's okay, Chair.
Of course, Matt, back to you.
Okay, so Councillor Doherty, I've seen your hands gone. We're just about to move on.
Sorry, Matt, and I was going on the basis I was going to wait to the end, and I was just going to go on our higher numbers here in West Berkshire, particularly amongst that age cohort, and the correlation, I suppose, between that and vaccines. And the dates and times of when people have had the vaccines and when vaccine programs started to roll out in comparison. I don't know if that's something you've had the opportunity to look at. That was all I was going to ask a question of, and I appreciate you may want to defer that to Joe's section, but just the correlation, I suppose, between the age groups that we're seeing a high propensity in and where we are in the vaccine program with those particular age groups.
Yeah, I mean, certainly, that's why we're seeing a number of cases within that age group, and also that they socially mix. But I guess the question is, how do we compare to other areas in terms of uptake of the vaccination? So I'm not sure whether Jo, she's probably quickly going through her figures, see if she can come up with that data and share that with us. But that's certainly something we look at to try and understand why that might be. Like I say, it's probably a combination of things rather than a single reason for this rise. But like I say, we're certainly behind the scenes trying to unpick that data and understand why. So I just wanted to show you, I mean, what we do feel is testing has probably played a part in that. But again, we know that testing rates are probably going up elsewhere across the country as schools return. I've just highlighted the three specific parts of the graph here. On the left-hand side, the left axis, you can see the test rate per 100,000. On the bottom, we've got the dates. And obviously, the three I've just highlighted is the 17 to 18-year-olds, 19 to 24, and the 11 to 16. Particularly 11 to 16-year-olds, you can see quite a significant rise. as you can expect, as people are returning to school. And in a good way, that is good, because we are identifying people before they actually do return to school, and that's what schools have been encouraged to do so. So community, the transmission is not necessarily taking place in schools, it's in the community, or being brought in from the community and being stopped before it gets taken into the school. So clearly testing will have an impact in terms of some of those cases and the rise. And with the wards, again, I don't really go into any of these great details just because the numbers are relatively small per the wards and can skew the rates. We are seeing a little rise in Tilehurst and Purley, which we tended to see because it's on our border with Reading. We have tended to see a higher rise throughout the pandemic, but generally it's quite evenly distributed amongst most of our wards. So in terms of patients submitted to RBH, so we are seeing a slight rise in the hospital admissions, although the daily numbers are low. So there's 6 new COVID-19 admissions on the 29th of August. And many of those that are going into ICU have not been fully vaccinated. And then when we look at a number of patients in hospital, there's 43 on the 31st of August. So that has started to creep up. I think you'll probably recall a month ago, we were looking around 15 to 20. It's slowly creeping up. It's around 43 that we're kind of seeing in any run time going into hospital. So I know there are some pressures being felt within the hospital, but clearly if you look at that graph there, we're not seeing anywhere like what we were seeing in January and March, but a concern nevertheless. And then in deaths, obviously the positive news that comes out of this is obviously those number of COVID-related deaths have dropped significantly and they remain low. So you'll see over the last few weeks, we've not had any COVID-related deaths. So again, just showing the success of the vaccine, that it is really highly effective. And I think we just need to continue to push that message that vaccine is very much our way out. And it's clearly just showing in the data in terms of number of people that are getting COVID that haven't been vaccinated, and also those that are suffering ill consequences. So that concludes my presentation. Happy to take your question, Councillor Masters, next.
Yeah, if that's okay, Chair. Yeah, so looking at the data on the heat graph, Matt, it's quite apparent that, as Councillor Doherty mentioned, the impact of vaccinations, because from a recent high of 1,200 on the 19 to 24-year-olds, that's actually come down, even though it's still in the black over 500 zone. It's still, that's come down markedly, while the younger cohorts continue to rise. So I know the vaccination program is now extended to 17, 18-year-olds. We hopefully will see that drop off as well, I guess. The public health will be hoping that's the case, in the same way as the 19 to 24 cohort. How long do you, in terms of vaccinations for young, I know the current policy is not for school age. Do you see that changing with different vaccinations through streaming or anything like that? So people are reassured that the younger school age cohort aren't bringing it back into the community?
Well, I think there's Yvonne Doyle from Public Health England yesterday actually said that a lot of the community outbreaks don't start from within schools, actually from community. I think in vaccinations, obviously we're waiting to hear what the Chief Medical Officer is saying around the 12 to 15 vaccinations. We've obviously heard from JCVI that they don't see any particular health benefit, but obviously the CMOs will look at the wider social context in terms of educational impact, and obviously they make that decision, I guess. But it's a really tricky one, and it could polarize people, and that's something I guess we need to be aware of as a board in terms of whatever decision is made. We just need to provide that right information so that people can make an informed decision about what they think is right for their children. Clearly, education is in schools is a place where our children need to be because of the adverse impacts from being out. So I think we'll wait for the CMO. I think that decision is due imminently. What I do know is that, and Joe might come on to this, we're locally making plans for the rollout of those vaccinations in 12 to 15-year-olds should that green light be given.
Thank you, Matt. Thank you, Chairman.
Councillor Doherty.
Thanks, Matt. Matt, you've been talking about obviously the hospital cases, and I appreciate you may not be able to tell us too much. And it's reassuring to see that they haven't increased in the same way as the number of cases, but there has been a slight increase. Are you able to say anything about whether those hospital cases have been vaccinated or not?
So on the main, they haven't been vaccinated, or they've received one dose of the vaccination. And often some of those individuals may have potential risk factors anyway. And obviously we're just understanding that data a little bit more. So yeah, in the round, it's mainly people that haven't chosen to have that vaccination or not had a vaccination, or they may not been able to have a vaccination for various different reasons. So that's certainly the picture we're getting. I think we just need to be mindful of that, as I said previously, is as community transmission will go up, we will likely see that spread into the older age groups, and potentially people that have been vaccinated may get poorly, but hopefully not as ill as what we would normally have expected.
Thanks, Matt. And a second question, if I may, Chair. Matt, you may not be able to answer it. It follows along Councillor Masters' line. So obviously we're now vaccinating plus 16s. Has there been any news or word on whether they will or will not be offered a second vaccination? Because the original call up was for all 16 pluses to have a vaccination, but there's been no discussion around whether they will actually come forward at 8 weeks or 12 weeks for a second vaccination. And I just wondered if there's been any more conversations or any movement on that.
Meredith might have a view. As far as I'm aware, I think it's they're continuing with the single vaccination. I don't understand. I don't believe there's any plans to have a second vaccination at this time.
Can I suggest that we hold that thought for the vaccination update when we come to it? Certainly the information I've been receiving indicates that any serious cases that have been hospitalized are people who at the very most have had a single dose, and for the most part are unvaccinated. So in the words of someone fairly senior in the NHS, the evidence of the power of the vaccine is increasing. So members, unless there are any more questions for Matt, we'll move on indeed to the vaccination update. And I think, Joe, you're going to lead on this, aren't you? Certainly the from where we're sitting, the question as to the rate at which 16 and 17-year-olds within West Berkshire are having the availability of the jab. I won't say receiving the jab, because obviously that to some extent is up to them and their parents as to whether they come forward. But it's the question of the availability of the jab to our young people as opposed to other bits of Berkshire West. But I'll let you pick that up as you go through it. Thanks, Joe.
Okay, thank you. I'll bring my screen back up. So if you don't mind, I'll provide my update in the usual format. I'll give you the latest data on the government dashboard and then move to my slide deck, which, although I have to put terms and conditions around how up to date the data is, has a bit more granularity, which can be useful. So we'll start as we usually do. The total number of vaccinations given to residents of West Berkshire is over 233,000, which is a substantial number. And most of the activity continues to be among second doses, with a low level of increased first dose take-up. So this is the line graph for first doses. They are on different scales, but this is for second doses. So just looking at the sorts of numbers we're dealing with confirms there is more activity in second doses, which is still a really good thing that those people are coming back for their second. So in terms of overall uptake, 87.2% of West Berkshire residents aged over 16 have received one dose, and 80.2% have received a second dose. Just going down to looking at first doses by age, we've seen very minimal increase in take-up in the over 18s, but we have seen a lot of additional take-up in the 16 to 17-year-old group. And as of the data update today, government's reporting 64.6% of 16 and 17-year-olds living in West Berkshire to have had a vaccination. Moving to my slides. So just to reiterate my normal caveats that the data on the slide deck can be up to a week out of date because we use clinical systems to get the information from, and by the time we've processed and validated, it's not quite as live as the dashboard, but it does allow us a bit more of a granular breakdown. And some surgeries are missing from this data set, so it is not a complete picture for all West Berkshire residents. I won't go through this slide again as I've covered the totals. But looking at breakdown by age cohorts, so this data from the 28th of August was reporting 42.7% of 16, 17-year-olds having a vaccine. So I think that shows the impact of the activity over the over last weekend, particularly around the clinic that was stood up at Northcroft Leisure Centre to provide a local option for that age group. Going further into the 16, 17-year-old take-up, I'll just highlight some of the points on the slide. So the higher take-up in Wokingham, reflecting that a lot of patients are going over the border into Bracknell, where drop-ins were being advertised to young people. And initially only PCN sites were able to offer vaccines to 16, 17-year-olds, which is why the West Reading Villages PCN, who've been working out of Pangbourne, have raced ahead compared to the other primary care network or PCN areas in West Berkshire. Walk-in centres were then made available. So in Berkshire, the Broad Street in Reading Mass Vaccination Centre was advertised. Also residents in West Berkshire, I know, will have gone over to Basingstoke and had done in good numbers. So I suppose to cover off now how that's been supplemented, we've used our colleagues in Oxford Health using either pop-up clinics or the Health on the Move van to stand up some pop-in, walk-in clinics. So Kennet School over the weekend of the 21st and 22nd. I think I understand from colleagues who were here that was stood up at very short notice and was very popular with 190 16 and 17-year-olds receiving their vaccine in those 2 days. I think the team worked tirelessly as they're not quite used, the van's a supplementary sort of offer, so it's used to dealing with smaller numbers, but they did really well, and thank you to everybody who turned up and their patience. I know there were quite big queues. We've also offered a few vaccines at Lambourne when we returned to do second doses for a lot of the racing staff and community. There was the Northcroft Leisure Centre pop-up, which was open between the 1st of September and 4th September. A total of 565 vaccines were delivered over those 4 days. And just a big thank you to everybody in the council who pulled together to get that set up at short notice. I think we're pretty pleased with how that went overall. And finally, yesterday at the Community United 1 community cricket event, and hopefully Councillor Masters' elbow has healed nicely after his sporting injury. There were many 16, 17-year-olds who took that opportunity, and I believe 40 vaccines were offered in total, but a good proportion would have been 16, 17-year-olds. Should I pause there for questions about this element of the vaccination programme? Because I know that's...
Why not, Joe? That seems to be the pattern of the day. So we'll start with Councillor Doherty.
Thanks, Joe, and thanks for everyone that's been involved in this. I know the pop-up's done some fantastic works over the course of the weekend, and the van's been busy too. So not taking away from that in the slightest, Joe, I have to sit here and ask why PCNs aren't doing cohort 12 over here in Newbury. And I look at those figures, and yes, I can look at Reading, but as a West Berkshire councillor, my interest is in West Berkshire. And I have to say, you know, why is it that we can have drop-ins and mass mass vaccination sites in Broad Street Mall, we can have in Basingstoke, we can have in Bracknell, and we haven't got that opportunity here in West Berkshire. It's a question I have to ask. Residents have raised it with me. I think the van's doing a great job, but when you look at the transport links and you look at the age cohort, why is there not somebody where here in West Berkshire, how we had the race course that could be set up for the 16 to 17-year-olds to drop in? I noticed Boots was doing a great job and they're advertising, but they're not taking cohort 12s. And I don't think the Kennett Centre is taking cohort 12s either. And I just question why the PCNs over in this part of the area aren't doing that.
Yeah, so the 3 PCNs and /9 surgeries who operated at the racecourse were part of phase 1 of the vaccination programme. So essentially the vaccination programme has been in 3 phases. The first was cohorts 1 to 9, so that would be the clinically extremely vulnerable through to the over 50s. So those PCNs were offered the opportunity to participate in phase 2, which is cohorts 10 to 12, which at the time was down to 18 and overs and has subsequently been revised to be 16 and overs. So they were not participating in that part of the vaccination programme, as everybody would be aware, because if you were aged between 18 and 50, you'll have had your vaccination either at a mass vaccination site, through one of the pop-ups, or one of our community pharmacy partners. So they were not in a position, because they're not participating in phase 2 of the vaccination programme, to stand up for that 2-year age group at the notice required. Most of those surgeries will be opting into phase 3 of the vaccination programme, which would be the booster campaign, which I'll come on to.
I suppose that just then raises the question of why they weren't involved in phase 2, which I think I'll direct towards our chair of our Health and Wellbeing Board at some point.
Direct it at me all you like. Whether I'll answer you or I can give you an answer, Councillor Doctor, I don't know. I think it's probably something we would want to raise either at Health and Wellbeing, or perhaps, and I've learnt not to seek to steer, something that we might mention to the Chair of Health Scrutiny, and put it no more highly than that, and let them make their own minds up. Councillor Stewart.
Thank you, Chairman. Joe, if I can, a clarification question, bearing in mind that I live in the east of the district, and my residents live in the east of the district, and you mentioned Reading and mass vaccination. Earlier on in the programme, there was some confusion about those who lived in West Berkshire being able to use the vaccination sites that physically sat within Reading. It appears from what you're saying here that those boundaries are now gone, and that actually it would be possible, somebody living in Tilehurst, West Berkshire, to be able to go into Reading Town Centre and receive their vaccination there. Is that correct?
So through the National Booking Service, boundaries have not applied. So it's been as simple as enter your postcode and it will tell you where the nearest centre is. Local authority boundaries have not affected where somebody can get their vaccine. In terms of going to a mass vaccination centre, if a patient has wanted to receive their vaccine at a local vaccination service, which were operated by primary care networks in our community pharmacy, they would have needed to wait for their GP to invite them for their vaccination at a location which may not have been their surgery, may have been a designated site shared between surgeries within that primary care network.
Okay, so in terms of walk-ins, it's possible now, I think is what you might be saying, that somebody that lives in West Berkshire, if their nearest sort of walk-in centre was Reading Broad Street, then they could actually do that and there wouldn't be any questions.
Yes, absolutely.
Brilliant. Okay, that's lovely. Thank you.
And Councillor Masters.
Thank you, Chairman. Thank you, Joe. I was going to ask the same question that Councillor Doherty did about the PCN situation, because I've had a few residents ask about that also. Just in terms of future pop-ups, have you got a timetable of that we can publish locally? I know we got the Speen Village Fete next Sunday, this coming Sunday, sorry. And that would be a great opportunity in a similar vein to the Community United event yesterday, which was, I think they ran out of vaccines. It was take up was extremely positive. I'm sure you can elaborate on that. And so that's pretty much my questions. And yes, my elbow's feeling a lot better.
I'll come on to the future schedule for the Help on the Move van pop-ups at the end of my presentation. But you just reminded me in respect of the primary care networks in phase 2 of the programme for the 18 to 50s. Particularly the racecourse operation was a huge undertaking, and the surgeries were really keen to get back to patient care, and there was a bit of competing demands of continuing the vaccination programme at the scale which they had done for the first 6 months of the year, and treating patients. So it's a capacity decision that was made.
And Councillor Doherty.
Thanks, Joe. You may just about to be coming on to this then. I had a question to me today from one of the officers here at West Berkshire Council. Will the vaccination bus be returning to where it's already been in 8 weeks? So those people that had their first vaccination from the vaccination bus, for example, in Lambourne, is the plan that it will return for their second dose in 8 weeks' time? But you may just about to be coming on to that.
Yeah, I'll come on to that at the end of my presentation.
Back to you, Joe.
Thank you. So I don't intend to go through the slide with the breakdown by age and ethnicity in detail because there's been it's a very similar picture to previous updates, unless anybody has any particular questions. And likewise, the at-risk and inclusion groups, growth continues to be among second doses. So there's not a lot of change there. I'll move on. So by our more deprived, lower super output areas or wards, we've commented many times about how there is usually catch up. It just takes a little bit more time. But particularly wanted to highlight that in the 16 to 17-year-old group, the 13 percentage point gap is 3 people. So now we're dealing with very small population cohort sizes. Percentages are only so helpful. So the long-awaited timetable for future van pop-ups. We are returning to Newbury College for second doses for those administered first time around. We've also put in an additional date for any remaining 16, 17-year-olds, and that's being advertised internally within the college, but members of the public will be welcome to come. So we'll be doing some comms on that upcoming. You don't want to go too early because there are plenty of other opportunities if people really want to get their jab sooner. A new date, which is Hungerford Town Hall. And finally, a return visit to Riverside Community Centre to provide second doses. The decision about whether to return to provide second doses is usually based on take-up and being able to allocate the van where it can be most effective. For example, if we only provided 6 first doses first time around, it's not an effective use of resource to go back just for those 6. So they'll be signposted to book seconds via the national booking system, or to use a GrabAJab website to find a walk-in service.
Before you move off that, you might want to revisit that before you publish it, Joe. Tuesday the 14th?
Yes, you're right.
Before you carry on, Councillor Burke.
Thank you, Chairman. Thank you, Joe. I noticed that one can book at Newbury College. Is there an advantage to residents or to the organisation to have bookable slots?
So Newbury College are offering for their students to book, so they've set up an internal booking system, but we've also ensured that there's enough capacity for walk-ins in terms of the number of vaccines brought with them. And I think different communities respond better to different mechanisms. Some like to just have the freedom of coming in, and others like to know that they can book. So I'll continue to be guided by kind of local communities on what they would like.
Councillor Masters.
Thank you. And it may have been touched. It may have been touched on before, but this is very Newbury and on the west of the district centric. Not wanting to steal Joe's thunder. Does do the pop-up clinics head out east? And I know we've had outbreaks in Councillor Bowick's. Of your numbers. Some of the more rural areas in that neck of the woods. Mortimer as well for Councillor Bridgman, etc.
Yeah, so we're balancing a lot of competing demands. We first started using the van at the end of June, early July. We're now 8 weeks on. So on one hand, we have an obligation to go back and return to do those second doses. Meanwhile, and continuing to engage with communities to find new sites. So it's just trying to balance those two and continually look at take-up data by as local a level as we can to see where it's most effective. So we'll continue to take all of that into account in our planning.
Just to pick up on that point, Joe, my recollection from earlier was that West Reading villages are operating vaccination out of Pangbourne. Now, that presumably includes 16 plus cohort. Am I right? You nod, thank you. Therefore, for those east of the district PCNs, and that's where they are, the West of Reading villages are to the east of West Berkshire, they're presumably hopefully picking up the 16, 17, 18 cohort in that whole PCN cycle of vaccination, leaving the other 3 lots of PCNs to rely, I guess, on either walk-in to whatever walk-in site there might be, or the van, or pop-ups, or whatever. Am I missing something there?
No, that's correct, particularly for that age group. Likewise, there are areas in Newbury Town Centre with a lower take-up, despite having both Boots on Northbrook Street and the Kennet Centre as bookable and walk-in. So, for example, Riverside Community Centre is a short walk into town, but we've done pretty well when we've gone there because it's a combination of the mass vaccination approach, a more localised approach through PCNs, and then a really hyper-local neighbourhood approach by having these van events. I think has been needed to get those that otherwise may not have come forward.
Okay, thank you. Right, any more, Joe?
So just to say a final point on the van, we are looking at how we use it going into the autumn. I've mentioned competing demands just as part of the general vaccination programme, but you've mentioned 12 to 15-year-olds, etc. We are moving into worse weather, so hosting outdoor clinics using a van and a gazebo is not going to be ideal or comfortable for patients. So we're going to review the strategy of how we use the van, but I'll continue to keep members and communities informed. And then my final slide, if I may, it's just for what we were highlighting earlier. So currently in progress is planning around vulnerable 12 to 15-year-olds and the 3rd primary dose for severely immunosuppressed patients, and being planned in shadow form ahead of national guidance is the universal offer to 12 and 15-year-olds and the COVID booster programme. So I am hoping by next time we'll be further forwards with the guidance on that.
Question for you. Is there a difference between a 3rd primary dose and a booster?
Yeah, so severely immunosuppressed patients who might be undergoing cancer treatment or who might have other conditions that affect their immune system, the vaccine is less likely to work well for those patients. So rather than that element being included in the booster programme. They're being offered a third dose of the first tranche of the vaccination programme. And
no, sorry, that wasn't my question. My question was, is there actually a difference in what they receive? Is there a difference in what a third primary dose is in the injection and a booster is in the injection?
I wouldn't know that. I don't believe so.
So Merridin's shaking her head. So, okay, is that it, Joe?
That's it from me. Thank you.
Fine. And does anyone have any questions on that last slide? No. Good. We move on then on to the PPP and where we are, and that's over to Sean. Sean.
Chair, I've got no slides, but I have got a quick presentation update. Sorry, for the board. So I'll start, if I may, with contact tracing and outbreaks. Just to take you back a few weeks, we in the week ending the 1st of August, actually, in terms of contact tracing, we dealt with 59 cases locally. By the week ending the 29th of August, we dealt with 116 in that week with a 75% success rate. But since then, since Friday, that's Friday through till today, we've dealt with nearly 150 cases in that time, which is basically a reflection, I guess, of the overall rates locally. Just in terms of outbreaks, we have dealt with a small number of kind of workplace outbreaks, an early years one, and then beyond that, there have been just a kind of smattering of cases in some high-risk settings, a couple of in separate care home ones, but not necessarily outbreaks, but just in single cases. Going forward, basically, we're obviously expecting that to rise as that cuts through, as the current increase in rates basically cuts through into the community at large. Looking at the issues with isolation calls, it's a similar picture. Obviously, as rates have risen, the number of isolation calls have naturally gone up, and we're having to concentrate resource now basically on those confirmed cases rather than the contacts of those cases. And that's where the current resource is going. But alongside that, we've also seen an increase in calls to the hub. So they had pretty well dropped away to kind of just 1 or 2 a day. We're now running back at about 10 a day in terms of hub calls. And also a fair number as well of referrals for assistance of those coming out of the isolation calls that we're making. What I can say is that the isolation calls are still very much welcome. We're still getting some very, very good feedback about that. And as part of all of that, we are about to update, along with Matt and the team, is to update basically the isolation pack that we developed some time ago, because it's now out of date, and we just need to basically to get it up to date, because with the feedback we're getting is that has been very much appreciated by residents. So just moving quickly on to issues around business support, if I may, Chair. So we're continuing to do visits to licensed sectors, and in particular hospitality, but also things like taxis and things like that, to try and encourage compliance with the guidance. And in particular with taxis, things like this, to try and encourage things like face coverings. And in fact, we are basically making them available to taxi drivers and things like that, basically for passenger use, where kind of stocks are low. We have done, we're also continuing to basically encourage kind of good use of ventilation in particular, but also basically testing as well among staff. Other visits that we've done, so at the end of last week, we visited both of the hotels that basically are currently accommodating the arrivals that we've had from Afghanistan, basically to look at infection control measures in the hotels, but also health and safety more generally. And we're working with Carolyn and the emergency planning team on that. And then finally, just looking ahead a bit to the issue of events. Obviously, we've had a fairly busy event season and a successful event season. And what I'm pleased to say is that actually the number of cases that have been linked to those events have been relatively low, which is a really positive sign. Going forward, obviously, in the next few weeks, we have a number of kind of larger events. We've got the Real Ale Festival coming up in Newbury this weekend. We have Rick Astley at the racecourse. And then looking ahead, we're also starting to do some work around the Michaelmas Fair as well, which is returning to Newbury. So we'll continue to work with all the organisers. We'll continue to attend them on a risk basis. We accept that what we're working with now is guidance, not necessarily legislation. But what I am pleased to report is actually basically with most of these organisers, they are following the guidance. They're making a lot of effort to follow the guidance that is available to them. So that's my update, Chair. Happy to take any questions.
Thanks. I will simply say that the event that I helped organise 2 weeks ago, we had the north wind whistling through the site, so we were unbelievably well ventilated. It was cold in parts, put it that way. Members, any questions for Sean? No, I see no one itching to ask. So, Martin, over to you to tell us where we are on comms.
Lovely, thank you. I do have some slides to share, but you'll be pleased to know not too many. So I'll just bring those up. Good evening, everyone. I'm the communications manager for the council, here to update you today on the activities we've been doing over the past couple of weeks or so. It won't surprise you to know that our theme over the past few days has been around the importance and availability of community vaccines and also testing, but particularly focusing on vaccinations and 16 to 17-year-olds and making sure that they and their parents know that vaccines are available, if indeed they want them, where they can get them as well. We've created a new webpage just to bring to pull together some of the different vaccination opportunities that exist out in communities. We know some pop-up clinics which are launched at short notice. So we'll be keeping that page, westberks.gov.uk/COVID-vaccination, up to date with the opportunities as we have them, and encouraging residents to check that regularly for opportunities in their area. Much of our work has been around running a digital campaign aimed at 16 to 17-year-olds and vaccinations over the past couple of weeks. So we've been down to speak to some of the young people getting their jabs, and got some sound bites and some photos of them getting their jabs, just to encourage others to do the same. We've been sharing that goes across our social platforms, but we've also been working as well with other teams to promote the vaccination details. We appreciate not everyone is online to the same extent. So we've been working with Newbury College, with our education team and others, just to share those details as and when they are confirmed. We had the discussion earlier about sort of online bookings versus walk-ins, but since we last met, we've launched and sort of designed and launched, an online booking form to support the 4-day vaccination session, which was run at Northcroft Leisure Centre over the weekend. We had almost 500 bookings for that, in addition to the walk-in appointments which were available as well. We're continuing to push out the COVID newsletter, still being read sort of around 36,000 times or so, which is a good opportunity for us to get information out to people across the district. And as part of the digital campaign, we've been running some paid ads targeting 16 and 17-year-olds across Twitter, Facebook, and importantly, Instagram, and those have been seen almost 100,000 times over the past 10 days or so. So some good reach there. I just wanted to share sort of another couple of slides, just to give an example of the types of content that we have been sharing. We talk a lot about sort of vaccinations and community testing, but this is just some examples of some of the content we've been sharing in the past couple of newsletters. Hopefully you can see enough of that to get a flavour. But everything from the sort of the COVID jab drop-in sessions to the One Community Cricket Day, which is sort of another way to get vaccinations, through to reminders about visiting festivals and other events, and importantly, sort of bringing that back into a back to school campaign that we're running through September as well. And similarly, here's just an example. Again, lots of lots of the same image, but just gives you an example of the different sort of Twitter ads and Facebook ads we've been running across different channels. Some of the young people that we've been that were happy to help us to get the message out about vaccinations and community testing updates as well. Really pleased to have some feedback this morning from Joe, who was saying that at the one community cricket event last weekend, in fact it was just yesterday, wasn't it, there was some good feedback from those getting their vaccinations, to say most or a fair chunk had heard about it from the newsletter and the social media we've been putting out. So from my point of view, pleased to hear that actually what we've been doing has been having a tangible effect in terms of getting people through to the vaccination sessions. So that was always all I was planning to take you through today, but of course happy to take questions on that, or indeed anything else that I haven't covered.
Anyone? No. Okay, so we move on to item 8 on the agenda and the proposed revised terms of reference. Now, members, I hope you've had a chance to have a look at this revision, which is in your pack. One amendment, by the way, officers, under membership, need to lose culture and leisure from my portfolio. Basically, you'll recall, members, that we wanted to update these terms in order to take account of the standing down and then, if necessary, standing up LOEB, and that is dealt with under meeting frequency 8, 9, 10, 11. So there are some parameters there at 11 around what would cause us to stand down if there was a lessening in those things, or cause us then to stand back up again, this board. So significant outbreak, rise in community cases, major change in national policy, or major incident. So those are the factors that we're proposing, are those that are taken into account. So the first question is whether or not there are any comments on this draft terms of reference, and then we'll come on to actually putting that question into practice in relation to the I don't know if it's the next item on the agenda or it's the question of future meetings. So does anyone have any particular comments to make on the revision apart from the one I've made? Okay, I will propose this revised terms from the chair. Does that find a seconder? I see all loads of hands. I'll choose Councillor Stewart on this occasion. Members, all those in favour of the revision, please show. That is carried. Thank you. Right, now, in anticipation of this meeting, Matt and Sean had a conversation which they then relayed to me, and it was in relation to effectively items 10 and 11. You'll note that the concept at 9 is that if the majority of the members of the board vote to cessate the board so that we stand the board down, we have to have the vote on that vote in favour of that decision, either Matt or Merredin or both of them if they're both in the room. And if we have stood the board down, and clearly you'll know that from the conversation we had last time, there was a semi-proposal in anticipation that that's what we would be looking at today. But if the board had been stood down, it could be stood back up again effectively by either me as chairman or by Matt as service director without having to go through a vote or anything like that. Now, I'll let Matt speak to this, but what Matt and Sean have basically come to say is actually the way things are going, we don't think we should stand the board down yet. So, Matt, do you want to speak to that? And then I'll come to Councillor Masters.
Yeah, I mean, that's exactly where I'm feeling. I think this part of the pandemic is the first time, obviously, our rates, if you look at 11.2, it talks about being above the national and regional average. And it's the first time that we are above that. And it could just be a blip. but I think it'd be worthwhile maybe holding another meeting just to see how that plays out and what the situation is looking like, maybe in a couple of weeks' time. So that's really what I would advise, but happy to listen to the board's views.
Well, I would simply comment that we now have a process for standing the board down. So if at the next meeting, for example, having had a conversation with you and with Meredith, it was felt that actually we could or should be standing the board down, both of you would have to vote in, if you were in the room, both of you would have to vote in favour of that, and the majority of members would also have to vote in favour of it. So we have a process for doing that. So I think we will simply take it that we are having fortnightly meetings as and until someone says, and I will be looking for both one or other or both of you to come to me and say, we think the time is now right to stand the board down. And until that point comes, I think we continue. That's my personal view, and I will look for members' guidance. Councillor Masters.
Thank you, Chairman. Yeah, that's exactly what I was going to say. I think, had we been way below the regional and national averages, there may well have been a case to stand this group down for the time being. But with the rising cases as they are, I fully support Matt's assessment that we should at least review next time, and maybe the time after, if we're still seeing a flattening out at the very least. Certainly not before we see a decline in the cases moving forward. So I would be happy to propose that if that needs to be a decision.
Thank you. And Councillor Stewart.
Yes, totally in agreement. I think we're at a point, an interesting point. We have schools back to normal, whatever normal is. So we may see some changes there. And we also are awaiting the guidance on the 12 to 15-year-olds. So I think at least one more meeting would be wise, because it may well be that we have that decision and we can work out what that looks like for our residents. But yes, I'm totally in agreement that we continue until we decide again that we should stop.
Then I will say, members, we will continue to meet fortnightly. If either Matt or Meredith decide that actually that should be moved to weekly, for example, I'm not saying it ever should be, but just in case, they would come forward and say, we think that's, Graham, we think that's where we are, and we would, put that in at the next meeting and move forward. Until such time as Matt or Meredith or both of them say, actually, we can now stand this down until something happens that we should stand it back up again. So we will continue a rolling programme, fortnightly rolling programme, until one or other of those things happens. So, members, the usual next item on the agenda is future agenda items. Usual caveat, if anyone has something they think, oh, we could be discussing that, or this has just popped up in the news or whatever, please approach me or Jack Gordon, obviously, who's not in the room at the moment, to suggest that, and we can get it on the agenda and make some moves as to who we might need to speak to it. Steve, future agenda items.
Yeah, thank you, Chairman. With that in mind, as we've got the schools going back, Joe just mentioned, we got the schools going back. Maybe somebody from Dominic, maybe Dominic or somebody from the education department can maybe come in and give us an assessment and review of how this first 2 weeks has gone with the schools coming back. I don't know if that's there's any merit or agreement from this group on that, Mr. Chair.
Well, let's have the man himself tell us, Councillor Bowie.
I think that's a fine idea. We can have a report. It might 2 weeks time might be a little early, but I think in principle it's a good idea. I was also going to suggest perhaps that we should consider having a piece on the 12 to 15-year-old universal offering. I sense that there might be some controversy around this. We're moving into uncharted waters to some extent, so I think it would be useful to understand what happens and what the reaction of parents in particular has been.
Okay, fine. Well, officers have heard those comments, no doubt taken them on board. I can have a conversation about future agenda items as we go. Councillor Burke, is that still your old hand, or that's what we're calling a legacy hand? Yes, thank you. Members, anything else you want to raise? As I say, just if something just suddenly pops into your head and say, oh, that's a good one for LOEB, just email me, email Gordon, email Jack, and we'll see where we go to with that. Otherwise, I'm going to call this meeting to a close and ask you all to stay in the room until Jack has confirmed we are no longer streaming.
Chairman, can I just confirm that we're returning exactly to a fortnightly
yes
schedule? So the next meeting will be the 20th.
Yeah, I'm not going to put it, because this meeting was 3 weeks. I'm not going to stick another meeting in next week. I think, we're now on a 2-weekly cycle from now.
Okay, thank you.